In this professional training video, you will learn important facts about Neostrata Pro System peels. Dr. Beth Bryden, a board-certified dermatologist, will explain the easy step-by-step procedure for safely and effectively using this professional system in your office. Neostrata Pro System peels were created by Drs. Eugene Van Scott and Ray Yu, the founders of the Neostrata company and the pioneers in alpha-hydroxy acid technology, who first introduced glycolic acid peels. In 1974, they published the first scientific paper on the benefits of using various alpha-hydroxy acids for many common skin conditions. Together, they've held numerous alpha-hydroxy acids patents. Let's first talk about alpha-hydroxy acids, also known as AHAs. These mild acids are found naturally occurring in certain fruits, such as grapes, apples, and citrus, as well as milk. Clinical research has demonstrated significant anti-aging, skin smoothing, and adjunctive therapeutic effects of AHAs. Glycolic acid is found naturally in sugarcane and is the primary AHA in Neostrata Pro System. Citric and mandelic acid found in citrus fruits and almonds are AHAs used in the two targeted peels. AHA peels are generally considered superficial chemical peels. Chemical peels are consistently among the top 5 minimally invasive procedures performed in office. They can be used alone or in combination with other procedures such as microdermabrasion, injectable fillers, neurotoxins, and light therapies to enhance aesthetic results. For many skin conditions, a series of glycolic acid peels can achieve results similar to those seen with deeper peels, such as TCA, but without the complications of these deeper peels. Pro System peels are an easy-to-offer, highly effective superficial peeling system for use by medical skincare professionals and are a cost-effective option for patients. These peels are appropriate for all skin types and provide an excellent way of introducing cosmetic procedures. They can be used alone or to augment the effects of other procedures and treatments you provide. Skin benefits can often be seen after the first peel, with enhanced and more noticeable benefits occurring over a series of peels. With so many different peel systems and solutions available today, it is important to understand how formulations differ. The clinical effects of glycolic acid and other AHAs are dependent on formulation bioavailability, which is determined by both concentration and pH. There are partially neutralized and free acid peel formulations available to physicians. Neostrata Pro System peels are free acid formulations, where the pH is low and the AHA ingredient is immediately bioavailable to skin. Conversely, only a fraction of the AHA is immediately bioavailable in partially neutralized peels, which have a higher formulation pH. The system features 6 flexible peel options that allow you to design skin rejuvenation programs specific to your individual patient's needs. It includes 4 glycolic acid rejuvenating peels at 20%, 35%, 50%, and 70% strengths with pH values from 0.6 to 1.6. The 2 targeted benefit peels are 30% citric and 30% citric plus mandelic acids. These Neostrata solution formulations enable quick, even application, immediate penetration, and enhanced control of the peel procedure. They can be used alone, in a series, or layered. By providing this range of peel concentrations and targeted benefit options, Neostrata Pro System peels allow physicians to better predict and control the outcome of the peel. The system offers a standardized approach to optimize the reliability, predictability, and control of peel procedures with little or no patient downtime. Careful selection of peel strength and exposure time enable the physician to more accurately control the depth of peel penetration and predict the degree of patient discomfort and amount of skin irritation. Neostrata Pro System peels are available exclusively to you, the licensed physician. Your knowledge and guidance is the key to optimal results. The better you understand the basics of the system, the easier it will be for you to recommend what is best for your patients. Please refer to the written physician guidelines on the package insert for complete instructions and warnings for this system, and follow appropriate procedures. Now, Dr. Bryden will guide you through the entire process of counseling your patients and performing Neostrata Pro System peel procedures.
Once a patient has expressed an interest in having a series of skin renewal peels, the process should begin with a consultation. During the initial consultation, you should discuss the patient's goals and expectations for skin improvement and review the medical history and any pre-existing skin conditions. Is the patient looking for an improvement in fine lines and wrinkles, improvement in skin texture, superficial acne scars, a general improvement in skin tone? Are there pigmentation irregularities that the patient would like to address? These are all benefit areas that can be improved with Pro System peels. What areas of the face or body need improvement? And how rapidly does your patient expect to see benefits? Does your patient require only minimal disruption in daily routine, or is some downtime acceptable? Does the patient expect a smooth, refreshed look immediately, or does your patient expect to see visible signs of a deeper peel? Pro System peels can be used on the face and other body parts to provide a refreshed, younger look with minimal to no downtime. During the initial consultation, collect a baseline photograph and review some pre- and post-peel photographs of other patients with similar skin types and conditions. You should also obtain a medical history, including experience with other skincare procedures such as microdermabrasion, microneedling, injectables, IPL, and laser or other light treatments. Review their current medical history, including uncontrolled systemic disease that may interfere with the skin's ability to heal. Also discuss any prior history of collagen disease, certain allergies, photosensitivity, viral infections, especially herpes simplex, smoking habits, and any use of medications. Discuss concerns related to a history of post-inflammatory hyperpigmentation or hypopigmentation. The patient's history will help you decide if your patient is a candidate for a series of Pro System peels, and will also help guide your selection of peel solution and process. It will also determine the necessity for special pre-peel considerations, such as the use of prophylactic antiviral medications. Patients who use topical prescription retinoids may have an increased reactivity to the Pro System peels, especially if their skin is not fully acclimated to the retinoid. In order to manage skin reactivity, topical retinoids and exfoliants can be discontinued for 1 to 2 weeks in advance of a peel. Oral retinoids must be discontinued for at least 6 months prior to peels. Collagen disease, bullous conditions, or uncontrolled systemic diseases such as diabetes, thyroid disease, and cancer can cause additional uncertainty with peels due to possible complications resulting from diminished sensory responses and longer healing times. Peels are not recommended for these patients. A history of hypertrophic and keloid scars is an exclusion to peels. Patients who use tobacco may experience prolonged healing times, so you should peel with caution. Next, describe the sensations that your patient may experience during the peel procedure, including mild to moderate discomfort such as stinging, itching, or burning. During the post-peel period, some redness, skin sensitivity, roughness, or peeling of the skin may occur. It is very important to note that an obvious peeling response may not occur. In fact, most people do not observe visible peeling. Perioral dermatitis, herpes simplex flares, and transient hypo or hyperpigmentation may also be experienced. Once you and your patient have agreed to proceed with the Pro System peels, you may want to suggest using Neostrata Resurface alpha hydroxy acid skincare products containing glycolic acid for 2 weeks prior to administering the peel. This is especially important for new peel patients who have not previously used alpha hydroxy acids. This step will help you evaluate whether your patient has any uncomfortable sensitivity to glycolic acid, as well as initiate the cell renewal process. Once the patient has been given the products and pre-peel instructions, an appointment for the first peel procedure is scheduled. The facilities and equipment for the Neostrata Pro System peels are very simple. The equipment includes a reclining chair or table suitable for positioning your patient. You'll also need gloves, towels, drapes, or a bib to protect your patient, and a disposable surgical cap or hair clips to secure hair away from the face. Petrolatum is used to protect sensitive areas. You will need a stopwatch or timer to precisely time the length of the procedure. A fan brush or cotton applicator pads and dispensing cup are also required for applying the peel solution. Other helpful equipment includes an ice bucket for ice water, 4x4 or 2x2 gauze pads. Optional equipment includes an electric or handheld fan which can be aimed at the patient's face to provide cooling as desired, as well as photographic equipment to capture before and after photographs. Patients are instructed to arrive on the day of the peel with a clean face without having applied any cosmetics, makeup, cologne, or aftershave. Male patients should avoid shaving on the day of the procedure if possible. Patients may wish to remove contact lenses. Have the patient cleanse their skin with a Neostrata facial cleanser to remove all traces of makeup on the treatment area and rinse. In the examination room, while the patient is sitting up, place the nylon bib around the neck and secure the hair with a surgical cap or hair clips. Place the drape or towel around the neck slightly under the jawline. Ask the patient to recline. The head should be slightly elevated. The procedure begins by gently but thoroughly cleansing the skin with the Neostrata Pro System Balancing Pre-Peel Cleanser. The purpose of using the solution cleanser is to remove remaining sebum and help bring the skin to a uniform pH. Allow the cleanser to dry. Do not rinse off the pre-peel cleanser. Next, do a visual inspection of the area to be peeled and note any abrasions, cuts, nicks, or areas of potential irritation or solution pooling. Petrolatum should be applied sparingly to these locations. Examples include the outer canthi, nasolabial folds, outer commissures, and the lips. Protect these sensitive areas from pooling of the peel solution with petrolatum. The formulation used for the first Pro System peel procedure should be the lowest concentration, rejuvenating 1 peel, the 20% strength of glycolic acid. As an alternative, one of the targeted benefit peels can also be chosen as a first step peel. Clarifying peel is a 30% peel containing mandelic acid and citric acid to target oily and acne-prone skin, while the brightening peel with 30% citric acid targets irregular pigmentation. The rejuvenating peel formulations include 4 concentrations of glycolic acid, including 20%, 35%, 50%, and 70%. This range of formulations enables the physician to safely design a treatment program around an individual patient's skincare needs and response to the peels. Transfer approximately 2 cc's of the solution into a dispensing cup. Once the clock timer is turned on, carefully apply the solution uniformly to the skin using a disposable fan brush, cotton, or gauze. Neostrata recommends using a fan brush, which allows for a quick and even application of the glycolic acid solution. Cotton tends to require more peel solution, and gauze can be somewhat abrasive to the skin. Application to all the treatment areas should be completed within 1 minute. Be careful to avoid dripping and ask the patient to keep eyes closed. If solution enters the eyes, flush with water immediately. You may leave the solution on the skin for up to 5 minutes as tolerated. The exposure time to the peel solution depends on each individual's response. If the solution dries on the applied areas before neutralization, additional applications or layering of the same solution can be performed. This may increase the intensity of the peel. Be aware that massaging, rubbing, or scraping the skin may substantially increase the penetration of the peel solution and cause a markedly increased skin response and a deeper peel. This technique should be done cautiously and only by a very experienced physician in accordance with his or her judgment. For those with less experience, do less rather than more. A gradual approach is always recommended. During the procedure, the patient is questioned regarding the intensity of stinging, itching, burning, and discomfort. Each patient's tolerance for these sensations will differ. The patient's discomfort is estimated by the patient verbalizing a number on the scale from 0 to 10, with 10 being the highest level of discomfort. The peel should be neutralized at level 7 or higher. During the time the peel solution is on the face, the physician must also monitor signs of penetration into the skin, including erythema and blanching. The degree of acceptable erythema depends on the patient's skin type. If epidermolysis occurs, which is visually apparent as white frosting or blanching, the peel is penetrating beyond the epidermis and is no longer considered to be superficial. Neostrata recommends neutralizing the peel if this occurs. When you are ready to neutralize the peel, have the patient close their eyes and lips. You may also cover the eyes with damp 2x2 gauze. Neutralization of the peel is accomplished by spraying the peel neutralizer onto the treated area. You can ask the patient to assist you by holding the drape or towel under the chin and against the ears to absorb excess solution. The neutralizer is specifically formulated to abruptly end further effects of any remaining free acid in the peels. Spray Neostrata foaming peel neutralizer liberally over the entire peeled area. Skin may experience a brief warming sensation. Effervescent foaming is due to the release of carbon dioxide on the areas of the skin treated with the neutralizer and indicates the pro-system peel acid is being neutralized. Gently blot the treated area with soft towels to remove excess solution and wipe the eye area with clean gauze. Reapply foaming peel neutralizer 10 to 15 seconds after the initial application. Neutralization is complete once foaming stops. The treated area is then covered with a wet, cool towel or ice 4x4 gauze, which provides additional relief from any residual sensations of burning or stinging. When the patient is comfortable, remove and gently wipe off remaining petrolatum. Ask the patient if there are any areas where stinging or burning persists. If so, spray once again with the neutralizer. When the foaming stops, the peel has been neutralized. Any residual sensations in these areas will gradually diminish with time. If the eyes are stinging or burning, flush with water. Immediately after the pro-system peel, apply Neostrata bionic cream or serum as tolerated. Products containing glycolic acid are not recommended immediately post-peel due to the potential for skin sensitivity. Once the skin is no longer sensitive, benefits can be maintained with any of the Neostrata skincare regimens. Patients should be instructed not to peel, pick, scrape, or scratch the skin. Use a mask or exfoliating products, wear tight headbands, hats, or expose the skin to sun or sun lamps. Patients should always use sunscreen when outdoors during the day. Neostrata Daytime Protection Cream with SPF 23 provides broad-spectrum sun protection for sensitive skin. The procedure that I just described is for a single peel application of either a rejuvenating peel or a single application of the brightening or clarifying peels. Pro System peels offer the flexibility of layering a targeted benefit peel with a rejuvenating peel to provide a step-up approach and enable targeting of specific skincare concerns. The brightening or clarifying peel can be used as a first step layered under a rejuvenation peel to provide enhanced targeted benefits to the peel procedure. Let's review the layering procedure now. Layering increases peel strength. Layering of the brightening peel with the rejuvenating peel is recommended for patients who wish to target uneven pigmentation and discoloration such as photoaging-induced dyschromia, sunspots, and/or melasma. Layering of the clarifying peel with the rejuvenating peel is recommended for patients who wish to target acne-prone skin conditions, including superficial acne scarring or spots. To prepare a patient for a peel, you may follow the same pre-peel instructions used for a single peel application. Select the appropriate rejuvenating peel strength and the brightening or clarifying peel as the targeted benefit peel. Approximately 2 cc's of each peel solution is transferred into separate dispensing cups. Carefully apply the targeted benefit peel solution uniformly to the skin using a disposable fan brush, cotton, or gauze. Leave the targeted benefit peel solution on the skin for up to 2 minutes. If the patient cannot tolerate the targeted benefit peel, proceed to neutralization. If the patient is tolerating the targeted benefit peel well, next carefully apply the rejuvenating peel solution over the targeted benefit peel using a disposable fan brush, cotton, or gauze. Leave both solutions on the skin for up to an additional 5 minutes. The total time for both peels should not exceed 7 minutes. Each peel application to all treatment areas should be completed within 1 minute. If the solution dries on the applied areas before termination of the peel, additional applications or layering of the same solution can be performed. This may increase the intensity of the peel. Be careful to avoid getting solution in the patient's eyes. If contact with the eyes occurs, flush immediately with water. It is important to note that sensitive skin types usually benefit from shorter exposure times in addition to a gradual progression in peel strengths, starting with rejuvenating peel 1, the 20% glycolic acid, or a targeted benefit peel alone. Caution should be taken. Some skin, such as Asian skin, can be sensitive and sometimes unable to tolerate high-strength peels. Patients with a darker complexion have an increased risk of hyper or hypopigmentation following deeper peels. Peels should not be repeated on patients having unresolved changes in pigmentation. Patients with a history of atopic skin reactions, eczema, seborrheic dermatitis, rosacea, or other sensitivities could indicate that the client has very sensitive or reactive skin. When the peel procedure is complete, verbal direction should be reinforced with written instructions. Supply your patient with bionic cream or bionic serum and post-peel instructions which are provided by Neostrata for your patients. Subsequent peels can be scheduled and performed at 3 to 4 week intervals as long as the skin is fully healed and there were no complications. If the skin is not fully healed, increase the interval between peels to 4 to 6 weeks or longer as needed. Subsequent peels should begin at the same concentration level as the current peel until the maximum time of 5 minutes alone or 7 minutes when layered is reached. After maximizing a concentration and time limit, subsequent peels may begin with the next higher concentration for 1 to 2 minutes as tolerated. It is often advisable to stay at low concentrations to avoid complications. Not all patients will be able to proceed to a layering step or to a higher strength rejuvenating peel. I think all your patients will find the Neostrata Pro System peels provide exceptional rejuvenating and adjunctive therapeutic benefits.